Hi, I'm Kayla Osorio. According to American Association of Orthodontics, archaeologists have discovered a Greek appliance that indicates that we have been practicing orthodontic care as early as 10,000 BC. Archaeologists discovered that part of their burial process included putting a appliance in their mouth, kind of like a retainer or a hard night guard. They did this because they believed if they did, when the deceased reached the afterlife, the deceased would continue having their beautiful, perfect, straight teeth. So today I'm going to talk to you about orthodontics, obviously. The reason I'm going to talk about orthodontics is to share the basics of orthodontic specialty and then also to share the protocol when selecting patients, at least for the military. It's a little different in civilian side. So there are two types of orthodontic care. There is limited and then there's comprehensive. Limited refers to having one or two things that they need to hurry up and get done. Limited usually happens for little kids, usually like 7 years old. So for a 7-year-old that has baby and adult teeth, they probably receive an expander and then that's it. For comprehensive, it's a little bit more comprehensive. There's more that you have to get done. So we take like a 15, 16-year-old patient with severe crowding, they need braces, extractions, and that type of care would end up being 2+ years. Whereas limited would most likely be like 6 months, if that. Now, with the types of orthodontic care, there's also phases. So, for the phases, it'd be the same person. Phase 1 is interceptive. So, meaning we're like quickly getting in there before they're finished growing so we can get something changed before they're done growing. So we take like a 7-year-old, they'd get an expander, they'd keep it in until they're 8 years old, they'd take it out, and then they wouldn't have braces, we wouldn't be doing anything, we just let them grow until they're like 12 years old. That same patient, now 12 years old, they'd have all adult teeth, no baby teeth anymore, there'd still be a little bit of crowding, so we treat them with full braces, like normal. But because we did the phase 1, it'll be a little bit easier to get that perfect straight teeth. Now, in in the military, what counts as an entitlement? A lot of people think, oh, I'm in the military, I am entitled to orthodontics. That's not exactly the case. Entitlements in the military would be your annual exam, your cleanings, your root canals, your fillings, stuff that you need because it is detrimental to your dental health. Whereas orthodontics, it's not essential for your dental health. Sometimes, yes, it can be, but 99% of the time, it's not. You don't have to have it. You can live without having orthodontic treatment. So for our choosing, processing, selecting the patients, what we do at Lake and Heath at least, each month, each doctor has roughly 15 evals. And then at the end of the month, we all sit down and we have an orthodontic board. At this board, we stack and rack all the patients, all the evals we had for that month. How do we stack and rack those patients? So for active duty, our priority list starts with number 1, the patients who are having treatment by other specialties, such as they're getting an implant or they're having jaw surgery or extractions. So we choose those patients first. After those patients, we choose patients that have had trauma or injuries. So somebody was riding a scooter and they hit their face and now their teeth are all wonky. We choose those patients next. After those patients, we choose patients that are within our Air Force dental residency program. So meaning for that is the Class 3 patients, which I know most of you don't know what Class 3 is, and that's okay. Class 3 is somebody that needs this done, kind of. It's really hard to explain what class 3 is without you being in dental. And then after that, we choose patients who already have braces on. They PCS'd here and they have braces, so we treat those patients. It's a little bit different for family members and dependents. They have a little bit different scale. So for the priority for family members, dependents, the first people we'd choose out of them would be patients that have braces on. They PCS in here, they have braces on. But we have to make sure that those patients got their braces put on before their sponsor's assignment. We always check for that. After those patients, we choose patients with serious functional developmental problems, such as they're having a hard time breathing or eating or chewing. Something isn't working right. So we choose those patients next. After that, we choose patients whose teeth are almost done growing. They're almost out of that growing stage. Why we do that is because it's a little bit harder to move the teeth when you're done growing. After that, we choose children with mixed dentition, which means they have baby teeth, adult teeth. It's all mixed. It's all jumbled. We choose those children. Usually, those children would be the type 1 type orthodontics. It wouldn't be that long. And then after that, we choose patients who have braces on when they PCS, but they got them put on after their sponsor's assignments. Now, this doesn't seem like that big of a deal. At least to me, it wasn't that big of a deal when I first joined orthodontics. But now that I've been in there for almost a year, it does make a difference. The reason being is because we have a lot of patients who come in or they get their assignment and say they see Lincoln at the orthodontics. Let's hurry up and put braces on my son or daughter, so they have to get treatment. And unfortunately, we can't do that because unlike civilian side, they will take anybody. You have a little space. Your one tooth is a little crooked. They'll take you because that's more money that they're making. Whereas for us, it's Uncle Sam. Uncle Sam's giving us an allowance, and we have to juggle how many patients we can use with this allowance. So we can't take everybody, unfortunately. I would love to fix everybody's. And lastly, braces cannot be given to you if it's only aesthetics only, at least for in the military. If it's just one crooked tooth or one little gap, we unfortunately can't fix that. We also can't help if you have poor oral hygiene. Why not? Well, we can't really treat you if you can't take care of your teeth without braces. Because if you get braces put on, that's 20 times harder to clean your teeth. We don't want to put something on there that's going to end up giving you cavities. Which brings me to my next reason. You can't get braces if you've already had multiple cavities, because you cannot take care of your teeth with braces. Take it from me. I have braces. It's hard to take care of them. And lastly, you cannot get braces if you have a DROS less than 2 years. And for surgical cases, you can't get braces done if you have less than 3 years. So that's a little bit about ortho. Have a great day.